Hi, I'm Peter Roper, and this is Community Buzz. And today we're fortunate to have a guest with us, Jennifer Muggeo. She's Deputy Director at the Ledgelight Health District. Welcome, Jennifer.
For having me.
And we're going to talk about vaccinations, specifically for COVID-19. COVID-19 has threatened and disrupted all of us for over a year now. And I know that most of our viewers and even non-viewers would just like to put it behind us and move on. So let's talk about what would make that possible. At this point, vaccinating as many people as possible is the best way to get through this with a pandemic and back to normal, I would say. Is that true? Am I making that up?
You are not making that up. The data are certainly backing up our efforts to get as many people vaccinated as possible. We've seen absolutely dramatic decreases, not only in the state, but across the country. As more people in the community are vaccinated, the number of hospitalizations and most importantly, the number of people dying are dramatically dropping. So we have been since January, all hands on deck here. Full steam ahead, whatever powerful metaphor you want to use, trying to connect as many people as possible with vaccinations.
Mm-hmm. Feels like this is kind of a marathon. I think we started out kind of floundering and maybe going the wrong direction and running in circles, but it seems like we are on the right path now and we are getting closer to the finish line, but not there yet. What's the overall goal of a vaccination program beyond protecting an individual who's getting vaccinated?
Well, as we've seen with so many other infectious diseases, with COVID as well, the more people in a community that are vaccinated, the lower the transmission rate of that agent. And so we want to reach as high a proportion of people vaccinated in our community as possible. There will be some folks who are not able to be vaccinated for one reason or other. A prime example right now is there is no vaccine that's currently authorized for use in children under 12. And I have, someone in my household who's not able to be vaccinated. I'm sure a lot of people that are watching today have someone in their family who's not able to be vaccinated because of the age restriction, if nothing else. And so by the rest of us in our household who are able to be vaccinated, getting vaccinated as soon as possible, we've not only protected ourselves as individuals, but we've added a layer of protection to our household and for our family member who's not able to be vaccinated, because not only do the vaccines reduce the likelihood that we will as individuals get sick, but they also reduce the likelihood that we will transmit COVID-19 to somebody else.
Mm-hmm. I hear about herd immunity and I think I understand it, but could you talk a little bit about that? What is that? And is it the goal at this point?
So the concept of herd immunity is that we as a herd, as a group in a community, we reach a level of immunity by having a certain number or percentage of people vaccinated, like I was just talking about. And when we look at different infectious diseases and vaccine preventable diseases, we start to get worried for things like measles. If the vaccination rate in a school community drops below 95, then we start to think about putting some efforts into making sure that we get that threshold up higher. In the beginning of the COVID pandemic, and when the vaccines were initially released, there started to be different thresholds thrown out there about what herd immunity could look like for COVID. The reality is that it's not a defined percentage. It's not something that we can stick a pin in and say, okay, when we get there, we're all set. And there's lots of different reasons for that. One reason is that we're still learning about COVID-19, but the other reason is, as most people are aware, there have been variants of the virus that have emerged over the last 6 months, especially. And so we don't have a set number that is our end goal. Our end goal is really to get as many people vaccinated as possible and to understand that the higher coverage we get, the more protected a community is going to be.
And I'm hearing Biden is aiming for 70%, I think, by July 4th.
I heard that the latest goal out of the administration is 70% of adults would have initiated, which means gotten at least one dose if it's a 2-dose vaccine by July 4th. And certainly Connecticut, I think, is already there, but only 12 states are. So when we look across the country, there are pockets of much, much lower coverage, and also across Connecticut. And this is not surprising to anyone who follows data regarding health outcomes, right? Whether we were looking at COVID itself, whether we go pre-pandemic and we look at heart disease or diabetes or asthma, there are certain communities, there are certain members in communities who have been placed at risk by systems of oppression, and they face a higher likelihood of poor health outcomes because of that. And so the same thing happens when we are looking at access to protective factors. Unfortunately, in the beginning, the supply of vaccinations was so low, so much lower than the demand. The systems that were structured in order to prioritize folks for eligibility and in order to schedule folks for appointments and make clinics manageable, were really created within those same systems that benefited some folks and not others because of other oppressions in other systems. So when we think back to January, February, even the beginning of March, our phone lines here were ringing off the hooks with people who were saying, I was up at midnight, I refreshed my browser 17 times and I still can't get an appointment for 3 weeks from now. And that's frustrating, 100%. But we have to acknowledge that there are some folks in our community who are not able to be at their computer for hours at end, refreshing their browsers. They don't have reliable internet access. They're working 3 jobs. They don't have the time to sit there and refresh the browser. They don't have the time to take off of work and not risk a reduction in their compensation. Maybe they don't have reliable transportation to get to one of the mass vaccination sites that the hospital system stood up at the casinos. So there's all of these confounding factors that went into what we see now in the data, which is are inequities in vaccination coverage. And particularly as we often see, they're centered in kind of urban centers across the state where so many other inequities show up because of the way our systems of economics and employment and transportation and all of those other systems are structured. We see those having significant impact on people's health outcomes.
So what's going to happen, for instance, if we don't do a serious vaccination program and the virus continues to spread and possibly mutate, which, as you mentioned, it seems to be what's happening. What is that going to do to us?
Well, I don't have a crystal ball and it's hard to say, right? I think that in the beginning, we may see that it doesn't impact us across the board like COVID did for the last year. We may see, and certainly if we just don't even just look at individual communities in our state, but if we look at kind of vaccination coverage around the globe, right? Well, we see, if we look at the vaccination coverage map, we see reductions in hospitalizations and deaths in the United States where vaccination coverage is increasing. And we don't see that in countries that have much, much, much more limited access to vaccinations. So for a while, that's great that the reductions in deaths in our communities, in our country is happening. But we don't live in a isolation and there aren't walls up that the virus knows to stop at our border. So, we have an obligation as human beings to look at vaccination access outside of our own communities, but it also will eventually impact the health of our communities if we don't achieve vaccine equity.
So how do you think we're doing in Connecticut? I sense that we're doing pretty well, and compared to other states, we seem to be doing much better.
That's true. If we look at the list of coverage of the states, I heard on NPR today, we're one of 12, I think, that have reached that 70% goal already. A few weeks, almost a month, actually, before the president's goal. But it's not across the board in Connecticut. There are significant differences in coverage if we look at some of our towns compared with some of our towns, and particularly our cities. And so our efforts over the summer are concentrated on identifying, recognizing those structural barriers that I talked about, and making it as easy as possible for folks who have faced barriers to get access to the vaccination. So we're holding clinics in different locations. We're holding clinics at different times of day, on different days of the week. One interesting study I saw a few days ago was that it's a concern for folks getting time off from work to get the vaccination, but it's of bigger concern the idea that they might miss work or school because of side effects after the vaccination.
Right.
So if we think about, I have a Monday through Friday office job. My weekends are standard weekends. I can schedule my vaccine appointment on a Friday so that if I do have side effects, I'm down and out, but it's a weekend. It doesn't disrupt my professional responsibilities. Some folks have Monday and Tuesday off. And not the weekend. So if we can offer access on a Sunday for them to get vaccinated, that might be something that feels more comfortable and accessible to them. So being in as many places as possible, at as many times as possible, and being there in a way that feels comfortable and welcoming for folks. We really and truly just want everybody to be able to get vaccinated when they're ready to get vaccinated. This isn't about us questioning anybody or judging anybody. We really, really are just so happy when people get vaccinated. So we hope that people ask their questions. It's valid to have questions about this. This has all been such a confusing year for us all. Yeah. There's lots of conflicting information out there, and we want people to feel like they have had time to make their decision, that their questions have been answered, and when they're ready, we're ready.
That's exactly why we're doing this, to get information out there so people can make a decision on knowledge.
Great, thank you.
But the rate of vaccinations has tapered off, and I think there are a bunch of reasons, and you've already hit some of them. But I think initially accessibility, the fact that people had to cross the state to get them and schedule them at way ahead and spend hours, like you were saying, on computer, on phone, that I think has gotten much better, because I think there are a lot of places now, and they're pleading for people to come in. So we may have gotten over that one.
Yeah, it's certainly easier to find an available appointment. And in fact, many places aren't even requiring appointments anymore. Most vaccination providers have shifted to walk-ins. I think that, that's fantastic. And that's one small change that has happened in the system to make it easier. But that doesn't change all of those complexities that people face in their individual lives. Yeah. And, for so long, the message was, we have to prioritize people in this age group. They're dying more. It's more serious if they get COVID. We are kind of, now we have to not undo, but we have to help people understand that now it is important for them to get vaccinated. So for a long time, the message was for people in their 20s, it's not your turn, it's not your turn, it's not your turn. Well, of course, it's not surprising that this has not become something that's a priority for some folks. Last night we were at an event in New London. It was like a street festival. People were out
eating the streets,
right? Yeah. So if people were out to enjoy food and beverage with their friends, to socialize, to be out in public for the first time in eons, to see some fireworks. And some of them opted in for vaccination because we were there where they were. And there's nothing wrong with that model. We should make this very, very easy for folks.
Yeah. One concern I know is that the vaccines were developed really, really quickly, and that makes some people say that they don't trust them, and it's experimental, and you should be worried about it. You want to address that a little bit? Talk about that issue.
Sure, and that's an understandable concern. I hope that folks will read the scientific literature about this and not kind of the social media made up literature. But the technology, when we're talking about the what we call the mRNA vaccines, and that's the technology that both the Pfizer and the Moderna vaccine use to deliver the vaccine and teach our immune systems how to respond. That mRNA technology is not brand new. That was developed over a decade ago. It's been used in other successful vaccination campaigns. Some people viewing will remember a few years ago when there was a lot of attention around Ebola, and we were monitoring that. That didn't end up impacting our community in the same way COVID did, but it certainly was an infectious disease we first saw in another country, and we were watching and preparing for it to impact our communities here. But the Ebola vaccine uses that same technology, and that was a successful vaccination campaign. So that background technology, the basis of the vaccine, is not new. It has been used, it has been tested, it has been proven to be safe and effective. It just hasn't been used in vaccines in our country very often, and so people are not familiar with it. We are more familiar with the technology that the J&J vaccine uses, which is an antivirus technology. But yes, the vaccines are new because the virus is new. So we had to develop something that was new in response to this new virus. So it's valid to say that. It's valid to have concerns and questions about that. I would encourage everyone to understand that there was robust testing that went into monitoring these vaccines for both safety and efficacy, and really thank the thousands of volunteers who stepped up to participate in the clinical trials. They entered into this as part of our country's effort and our global effort to stop the pandemic, and did their part. They didn't know if they were getting the real vaccine or a placebo, and they participated in regular testing and monitoring of symptoms. And both the data from those clinical trials and the data that we have continued to monitor as millions and millions of people have been vaccinated now are that the risk of serious side effects from any of the vaccines is so much lower than the risk of serious illness and death from COVID-19. And so it's understandable people have questions and concerns, but I hope that they will balance those concerns with concerns which are just as valid and more real, real risk of not being vaccinated and contracting COVID.
Yeah, COVID is not fun. So, and I think all of the vaccine makers have now applied for the official approval. They were approved for emergency use.
Yep.
Now I think the official authorization is in the works. So I think that may encourage people a little bit more too to feel it's safer.
I hope so.
Yeah, and there's no truth to the fact that it affects your DNA or changes your DNA. That's one of the bugaboos I think that have been mentioned.
Right. It doesn't use DNA. It doesn't change our DNA. It doesn't touch our DNA. The unfortunate initials of the RMNA made it easy for that kind of rumor to spread.
Yeah. And I have to say that the TV ads are not helpful for people who like needles, because there are a lot of needles now on people talking about COVID, talking about the vaccine. And I for one, got the Pfizer vaccine, and the needle is significant, but it was probably not as painful as giving blood. So it was not something to worry about. And my shoulders a little sore, but.
And I'll testify, my 12 and 13-year-olds were vaccinated, and my 12-year-old, her whole life, getting her vaccinations has always been a nightmare of a doctor's appointment, and she didn't even flinch. So.
Yeah. And there are some side effects that you can have, and I know from experience again that they keep you there for 15 minutes to observe you and make sure you don't have an immediate reaction, because I guess there's a chance of that.
So sure, with any vaccination, there's a chance of an adverse reaction, particularly in folks who have had an adverse reaction before. So we do ask people to stay. If you haven't had a reaction before, for 15 minutes, if you have, for 30 minutes, and just monitor that. The data shows that if somebody is going to have a severe allergic reaction to the vaccine, and go into anaphylaxis, that's going to happen within that 30-minute period. Mm-hmm. It's very, very rare. I think something like 1 in a million or something, but I don't have that figure in front of me. But it is tremendously rare for that to happen. But that is the reason for the observation period. After that, what we have seen is a certain percentage of folks will have one or more of some of the common side effects. Many people don't feel any side effects at all. One of the more common side effects is, a sore arm. Some folks have experienced a headache or fatigue. A smaller handful have experienced some flu-like symptoms that kind of have taken them out for a day or so. But again, those side effects don't happen across the board, and they don't last, and they are much, much, much less problematic than a serious case of COVID.
You talked a little bit about the issue of loss of work and income, and I think some of that's being addressed. I hear employers are trying to help people through it somewhat, and the timing of when you can get it certainly does help a lot. If you can just walk in and get it when you think you've got a time to do it, that's better than having to schedule and miss time from work. So hopefully that's going to go better. And I hear there's some 24-hour spots that are giving COVID shots, and
I think that the providers are trying to be as creative as possible with making this easy.
And there are some ethnic concerns that you mentioned a little bit, that people have had trouble with healthcare for other issues, and other diseases are going to have trouble with this too, probably because they're concerned about how they've been treated before, and it's a big concern, and hopefully they're getting better addressing that. And I know Moderna was developed by a Black woman, and she's out there promoting it very well, very articulate, and that should help some too.
Yeah, there's a lot of earned mistrust of our healthcare systems, of our government. It's understandable that people have questions, but it's also important so it's important for us to answer those questions, and also to take down all the other barriers, so that there's nothing structural in terms of appointment times or transportation or anything like that standing in the way of somebody getting vaccinated.
Mm-hmm. And I think you also talked about youth and invincibility, young people thinking they aren't going to get it and don't have to worry about it. And they were told to wait too. So that contributed them to say, no, I don't need it. But I think that's changing now. I even got an email today, I think, that said that there's a group doing texts to young people specifically urging them to go get the shot now. And that's great. That's probably the way to get them, is other people texting them and saying, go get it. So hopefully that'll be less of a deal. The whole anti-vaxxer thing is very concerning, and I'm sure it's not just COVID that's a problem, but to some of us, it seems a little bizarre. I saw a joke basically that was saying someone had choked on his food and he got really concerned about it because he heard people died from choking on food. So he'd stopped eating and he stopped feeding his kids because he didn't want to take a chance of them dying of choking on their food. And, you know, it's sort of a parallel that people are worried about the vaccines more than they are COVID. And, you know, that's disturbing because it could affect all of us. I don't know how we address that, but
yeah, and I think, you know, it's one of those really complex phenomena that, again, I'm not vilifying social media. I love to stay connected with my family and friends via social media. It's certainly been helpful this last year when we haven't been able to see each other in person, but it does also create this environment where people are held up as experts who don't, in fact, have a knowledge base to be basing their statements on. And so it is something that we continue to work on outside of COVID, is encouraging parents to understand the importance of vaccines and the safety.
We unfortunately are running out of time very rapidly here, but I do appreciate your efforts. Anything you'd like to say before we close this out?
Just thanks for your time. If you are out there and you haven't been vaccinated yet, if you have questions, if you are looking for a vaccination appointment, visit our website, give us a call. We really would love to answer your questions and get you connected with a vaccination.
Great. Thank you, Jennifer. I really appreciate it. It's been useful information, and hopefully someone will watch this and maybe change their mind or get a little fire into them. But it has been helpful. Thank you all for watching Community Buzz. Do your part, get the shot. It is free, and
Absolutely.
stay well. And now we're going to have a word from Dr. William Kober. He's going to talk a little bit about his expertise on vaccinating. And, thank you all for watching. Take care.
Hello, I'm Dr. Bill Kober, and I'm a practicing physician in Stonington. Needless to say, this past year has been both difficult and challenging for all of us due to the COVID-19 pandemic. Over 600,000 Americans have died due to this deadly disease, and millions more have been infected, many with long-term health effects. Fortunately, we now have the COVID vaccine, which has been working incredibly well at preventing infections and deaths. In Connecticut yesterday, for the first time since March of last year, we recorded 0 deaths. This demonstrates the amazing effectiveness of the COVID-19 vaccine. COVID-19 vaccines are now widely available in Connecticut for those 12 years and older. Over 167 million Americans have received at least 1 dose of the vaccine, and many are fully vaccinated. It means that they are 1 step closer to leading a normal life without the worry of getting infected. So, protect yourself, your family, and your community. If you have not already, please get vaccinated. This is the best medical advice I can give, and it's the one that I give to my family and friends and all my patients. The sooner we are all vaccinated, the sooner we can put this pandemic, this horrible scourge, behind us. You can find a vaccine clinic by going to connecticut.gov/COVID vaccine. Don't gamble with your life. Get the shot.